fibula. Fibula, you are having the bicortical is there. Just go ahead actually, okay. Just check it out whether the radiotherapy has been done or not. Better actually when the patient has been operated, do the implant right now. Professor like Cinco sirs, they do like that. When the trauma is there or actually when the case has been resected and the reconstruction is going on, they place this implant simultaneously. That is a perfect approach. Okay, they are doing the jaw reduction also with the BCS implant. I am just opening the dimension actually. You can talk to Professor Lysenko sir, you can talk to actually Professor Yan Harris, you can talk to Professor Vitome sir. They have opened a new dimension. Okay sir, but for me, it's always Dr. Ide sir actually. Sometimes when I post the cases, he is not replying. Sometimes he says, thumbs up, that means really I have done it something. Okay, really I have done it something. So, okay, what was that? I called up Dr. Ide sir, I told actually, sir, I have placed a zygoma implant in the mandible. He said, what? So, you can see actually, my idea was actually to place an implant to engage the native mandible and placing the implant in the graft and in the actual native mandible, so that I am going to have a better splinting of the graft also. And this, the surgeon, this was operated in a Manipal hospital, and the surgeon became so happy when he looked at the case and he told, yes, actually, whoever the doctor had thought this idea, the patient got really benefited. So, I am going to show you. Sir, see the graft? Okay, that is what you are talking about, sir. Okay. In the convention actually, they all talk about the removal prosthesis. Please understand, we are giving always the fixed prosthesis. This is a zygoma implant. Okay. Okay, sir. And this actually I have to take out the implant when we change the prosthesis. But you can see the fusion. This more than 1.5 years actually, then you can see the fusion actually. Another case, this case again it was given actually to me to buy this thing. Dr. Rohan Virani sir, okay. Limited mouth opening was there. Place the implant, this is the follow up, but how the chewing pattern is there? I will just show you. There is nothing like you cannot do the chewing pattern has to be symmetrical. Okay, already bilateral balance, because this patient what is having? The other side, the medial pterygoid muscle is just getting pulled up the mandible. You cannot have a balance. So, what I did, just keep the surfaces all flat. You will see the chewing pattern. However you feel comfortable, just chew it. Okay, like you are eating food. Earlier he was conscious. Now he will tell you how to chew. Look at my side. Yes. You see actually, this has to be supported by it. The other approach is actually you can make wherever the native mandible is there, you can make a double zone of the teeth setting. You can do double zone of occlusion surfaces. Okay. Okay. Another case. This case was been operated by Professor Vijay Deshmukh. We have so much of high regard for Professor Vijay Deshmukh from Aurangabad. Okay. This case has been operated. You can see how nice actually the healing is there of the graft actually. He is a legendary figure actually, Dr. Vijay Deshmukh. Yes, sir. So, I know actually if I am going to do any incision on this skin graft, he is going to slap me actually, I know that thing actually. So, for me it was all flapless protocols. This case I have been operated in the clinic of Dr. Yusuf sir and Dr. Sanjay sir actually, they are all sitting here. What is the key? Sir, I always give the sanitary, 3 mm clearance has to be there. None of the process tissue part should not touch the skin. Okay? Yeah. Of course, anterior, and this is the buccal bypass. This is the implant done. We have to create a platform, okay, to bring the teeth in the according to the supporting polygon. This is the case. Now you say we are doing only the full mouth cases. No, we do the segments also. Please. Okay.
Any experience of you placing the implants along with the reconstruction of implant?
No, sir. I have been not called actually, but please, if you have the case, please call me actually. Let's do. I am getting bored actually. Please understand. Sir. Thank you very much, sir. 2 years actually. Otherwise, just after the radiotherapy, within 3 months you can operate. Then you have to wait for 2 years. They say 1 year actually, but I want to wait for 2 years. Okay. Better to do before radiotherapy.
But sir, the majority of the times
Yes, of course, that's what I'm saying. After the surgery and before the radiotherapy, you can just place the implant.
Sir, would it be a contraindication to have metal implants while the patient undergoes RT?
No, there is no contraindication. In fact, it is written actually. The best way to place the implant before the radiotherapy only. Yeah? Yes. Pre-radiation, I'm talking about the pre-radiation. Okay, this is a single molar, we can replace. This is a single molar, we can replace. Okay, please, we had a talk yesterday. These are segments we can do. This is when you have a limited amount of bone is available. This is the Russian doctors are amazing actually, they are just amazing. They are doing such a wonderful job you can't imagine. They can do the zygoma implant just like a piece of cake actually, and they have shown me the way, they have shown us the way to place the implant engaging the lateral border of the nose, going along with the palatal. So this is how we can do it. This I have done actually recently with Dr. Jugal Patel sir. Okay. Now the anterior actually, okay, when you are having a, when you have a resorb anterior of the maxilla is there, see you can place the implant, and with just little, just using your common sense and using the contouring of the soft tissue, you can create aesthetics also. It's done. Take out this teeth, place the implant, immediately induce bleeding, 3 months follow up, you can create aesthetics also. Thank you very much sir.